Welcome back. If you need a knee replacement and want the most innovative procedure with the best results, you're in luck. There's an orthopedic surgeon right here in Michigan who was one of the first in the world to use a new robotic tool that measures ligament tension and range of motion, providing more accuracy for the surgeon and superior outcomes for the patients. This new tool is called the Balance Bot. Here to tell us more about his elite knee is Dr. Jeffrey DeClaire, our orthopedic knee specialist and founder of the Michigan Knee Institute in Rochester Hills, and joined by one of his patients. We've got Gretchen with us from Grand Rapids, who's had the knee replacement. Thank you both so much for being here.
Thank you.
All right, doctor, so tell us about this procedure and what makes it unique.
So the elite knee procedure is a technique of surgery that I've developed over the years that incorporates a minimally invasive methods, which helps to create a more rapid recovery, but more importantly, a combination of what we call computer navigation, which is a way to create a 3D image of the knee so we can accurately assess the ligament tension and actually predetermine the position of the knee to get that most perfect outcome to reproduce normal knee mechanics. And then it also incorporates a robotic assist method. I still do the surgery, but the robotic assist method incorporates all the specifics of where to place that implant so I can accurately prepare the knee for that outcome.
Okay, and it uses something called the Balance Bot. So explain what that is, and we're going to show some video, and you can kind of tell us how this works.
The Balance Bot is a method where it's going to apply tension to the ligaments. So traditional knee surgery relies on the surgeon's experience, landmarks, so that when he assesses the knee, we just sort of push or pull on the knee to assess the tightness or looseness. This, you can see, the Balance Bot applies a defined load independent on the inner and outer halves of the knee and creates what we call a kinematic graft. So you can see here that graft on the right. The blue line means we got some laxity. You can see the numbers there at the top and the bottom. That's an extension and flexion. Once I have that, I can position the implant very accurately to rebalance the ligaments. And then this is with the trial components in. You can see where the green lines tell us that we have that equal balance, and we're measuring this within a 0.5 millimeter. And I'm able to position the knee in literally in a 0.5 degree of rotation so that we can create that normal alignment and normal ligament balance.
Okay. Such precision, and then you've had some pretty good outcomes because, you know, not everyone's always happy with a knee replacement after they're done.
That's correct. What we've been real exciting is with a multi-center study nationally, we've got data on thousands of patients now that shows that patient satisfaction is near 98%. This compares to between 75 and 80% with traditional knee surgery, which means patients get rid of their pain, but the knee may not function ideally. And the goal is to restore that normal knee feeling, that normal knee, what we call kinematics.
Absolutely, and get rid of the pain. And you know, I guess the proof is in the patient. We've got Gretchen with us. Gretchen, tell us a little bit about your experience.
I was, not able to do things that I wanted to do. Couldn't walk up hills. I'm pretty active. Swimming I could do, but it was still painful. And I did some research and found Dr. DeClaire, and it was amazing. It really, my recovery was quick. I didn't spend the night in the hospital. Home same day, in the OR at about 7:02, in my car at 11:02.
Wow.
So, and we stopped once on the way home. Just after an hour, you didn't want me sitting in the car that long, and it was a very, very successful outcome. I'm active again, swimming, went on vacation in December, had a wonderful time.
Yeah.
So.
And you had the surgery in August.
End of August,
yeah.
And early December we were able to do our vacation.
Yeah, 18,000 steps, I heard.
Yes. Swimming in caves.
Awesome.
Yes, it was wonderful.
Gosh, and you're a nurse, so you did your research and you knew that this is kind of what you wanted to do.
Yes, he's very well known on the east side of the state. So.
Wonderful. So is this good for any patient? Is any patient with a knee replacement necessary?
Yes, absolutely. This is a technique that can be done on everybody. There's no specific indication for it. Essentially, it's using technology, which also every data point we capture is on a cloud base, so it allows for the ability to correlate patient outcome data, meaning we've looked at the most optimum outcomes of patients, correlating the position of implant to that outcome, that gives me that information in the operating room. And that's what's really been exciting about it.
Wow, just incredible technology and what it can
Yes,
do.
yes.
So if a patient is hearing this and they're having knee trouble, can they just reach out to your office? Is that
Absolutely,
what they do?
yes.
Okay.
For sure.
Okay, perfect. And you want to learn more about Dr. DeClaire, his research, the elite knee, you can log on to the MichiganKneeInstitute.com or give a call, 248-609-9111. We'll be right back.